so that might confuse somebody, just to be confusing. And I'm not texting, I'm just looking to make sure that I'm not running over time. I wanted to talk, really sort of preface what I'm going to say with two really important things I think to remember about the NHS. One of them is that we absolutely can afford it, and we're told all the time that we can't. If you haven't seen the Commonwealth report from 2014, go home and Google it, because it shows that the NHS is the most cost-effective healthcare system in the developed world. The other thing to remember is that publicly provided and publicly funded NHS is not a utopian pipe dream. Private providers are not better providers than NHS providers, and again, that's something we need to keep pushing back on. You look at what happened in Hinchingbrook Hospital, at the first whiff that they weren't going to make a profit, Circle bailed out of there. You look at Winterbourne View, you look at the PFI in Barts Health, which is horrendous, taking they've got a £93 million deficit, which comes out of our health economy in East London every single year. And we've got an election coming up, so we've got to keep the pressure up. We've got to keep campaigning, and I think Louise talked about, and Anna also talked about all of us getting together, coalescing our campaigns, talking to each other and uniting, because that's so important if we're going to fight to save our NHS. Politicians hate talking about the NHS, and they tried really hard before the election really got underway to keep it out of the headlines, but I think because of campaigns like yours, campaigns like ours, we've kept it there, and we've made them talk about it. So now they've promised things. They've promised that they're going to find lots more doctors and nurses. The Labour Party have promised to repeal the Health and Social Care Act, and that's really important. But we have to hold them to their promises. We know what happens after the election. They'll promise us anything to get our vote. But remember last time, Cameron and his no more top-down reorganisations, Nick Clegg, we're not going to have any tuition fees, and we mustn't forget that Alan Milburn, Labour Health Secretary between 2000 and 2005, was one of the biggest architects of private provision in the health service. So we've got to keep the NHS in the headlines, and we've got to remember that we can win as well, because I mean it's quite easy to sometimes get demoralised because there's such a sort of force against us. We can win. I mean, Louise talked about Lewisham and the fantastic campaign they had there. They prevented Lewisham and A&E being closed. There have been other successful campaigns, for example in the Whittington Hospital in North London as well. And our own campaign, Save Our Surgeries campaign, I won't go into the nitty-gritty of it in too much detail because I haven't got much time, but essentially what happened is that this time last year a number of practices in Tower Hamlets, where I work, realised that there was a funding formula for general practice was going to change, and we're in one of the most deprived areas in the country, and we realised that with the change of the funding formula we were going to lose, one of the practices thought they were going to be losing up to £1 million over 7 years. Now this is not income that goes into GP pockets, this is money which comes to practices to help to provide services, to employ staff and to actually get general practice up and running. So we started to flag this up. And we've had two fantastic marches where hundreds and hundreds of people came out on a Thursday afternoon. We walked from one end of the borough to the other. We had David Owen speaking, who's one of the patients at one of the practices. We had another fantastic march on the 5th of July, the birthday of the NHS. We've had a petition which we handed into Downing Street with our local MP, Rashanara Ali, for Bethnal Green and Bow, and we got over 150,000 signatures on our online petition. So we've got lots of media exposure, and I think that's really important to remember. We had a legal case. One of the patients at Jubilee Street, which is the practice that flagged this up to start with, took NHS England to court, and it was found that they had acted unlawfully for not involving patients in the decisions to reconfigure services. And if you remember No Decision About Me Without Me, that seems to fly in the face of what was promised before the last election. But that in itself, it's great, it's really important to do that. But we have to be on the streets, and we have to be on the streets in our numbers. And we're actually having another protest next week, because even though we have got some reprieve money, it's paltry, and we need to keep going. It's not just about us in East London, it's about the whole of general practice across the country. So, like Louise said, we have to build a broad-based movement. I think anyone who believes in a publicly funded, publicly provided NHS has a place in our movement. Doesn't matter about any other disagreements that we may have, but that's the thing we're fighting for, and that must unite us. But we also need to bring the power of NHS workers into play. And I just look at what happened. They had 2 fantastic 4-hour stoppages last year, where you had vibrant picket lines, NHS workers really up to fight, not just for their pay, but for the NHS. The NHS workers know that when they're out there on the picket lines, when they're on strike, that they're fighting for the NHS, the very survival of the NHS. And I think if only the health unions have the courage to stand up for the NHS, and Dave Prentice were prepared to use the power of their unions to demand not just the pay rises which NHS workers are entitled to, but also an end to the market in the NHS and a return to a publicly funded, publicly provided service. Ordinary union members have shown that they're really up for this. They came out and they just get confused and demoralised when they see the momentum building up behind them and the rug being pulled. So I think it's important for us as campaigners to work with hospital workers, support them on picket lines, show them the public support them. We understand that they're fighting for the heart of the NHS as well. And I think lots of hospitals, lots of NHS workplaces are poorly unionised, and we need to help to build the unions again in those places where we can. Because together, I think NHS workers and the public who love the NHS, we're all patients, we all need it, have the power to win this fight and to save our NHS. So, sticking to time, I think really we just need to, I'd like to finish off by quoting Nye Bevan, who said there will only be an NHS while there's folk with the faith to fight for it, and I think that really has to be us. So I think we need to go out there and do it.
Jackie mentioned the unions, and I think it's important that we acknowledge that we've had financial support from the GMB and United